Good afternoon. My name is Anna Wadia, and I'm a program officer at the Ford Foundation. And I'm thrilled to welcome you to this webinar on designing inclusive paid leave policy. There are 120 people on this call, which is just an incredible testament to the interest in this topic. As many of you know, the Ford Foundation has been working for well over a decade to make paid family and medical leave a reality for all Americans. It's been extremely exciting to see 5 states and the District of Columbia enact new paid leave laws. These states have all created social insurance programs to provide wage replacement when people need to take extended time off to care for themselves or their loved ones. This is a movement that has taken research seriously and has learned from the experiences in each state to improve policies in subsequent states. This is laying the groundwork for an eventual federal policy that is truly universal and inclusive and serves the full range of workers and families in our country. That's why it's so important that NACI is bringing its decades of experience on best practice in social insurance to inform the design of paid leave programs through the paper that it's about to release called Paid Family and Medical Leave Programs, State Pathways, and Design Options. I recently read an incredibly insightful article by Angela Glover Blackwell called The Curb Cut Effect. In it, she recounts how disability rights activists in Berkeley fought for and won sloping curbs to make it possible for people in wheelchairs to cross the street. Her article is so relevant to today's discussion that I'm going to quote it directly. She said, "Hundreds more curb cuts followed Berkeley's, then hundreds of thousands all across the country. Then a magnificent and unexpected thing happened. When the wall of exclusion came down, everybody benefited. Not only people in wheelchairs. Parents pushing strollers headed straight for curb cuts. So did workers pushing heavy carts, business travelers wheeling luggage, even runners and skateboarders. There's an ingrained societal suspicion that intentionally supporting one group hurts another, that equity is a zero-sum game. In fact, when the nation targets support where it is needed most, when we create the circumstances that allow those who have been left behind to participate and contribute fully, everyone wins." Today you will hear about recommendations to improve and expand paid leave programs which beautifully illustrate this curb cut effect. Katherine Gallagher Robbins from the Center for American Progress will talk about the importance of including a broad definition of chosen family in paid leave laws. These recommendations grew out of a deliberate and thoughtful process over several years of bringing together paid leave and LGBTQ advocates. What has resulted is an expansive definition of family, most recently codified in the Paid Sick Days Law just passed in Rhode Island, that makes leave more accessible to the myriad types of families in our country. Although growing out of the LGBTQ movement, this expanded definition greatly improves access to paid leave for all families, whether grandparenting families in low-income communities, immigrant workers dependent on extended families, or people with disabilities and wounded warriors who have built a support network of friends as well as family. Similarly, the recent paper co-produced by the Georgetown Center on Poverty and Inequality and the ARC, entitled Security and Stability, Paid Family and Medical Leave and Its Importance to People with Disabilities and Their Families, explains how crucial paid leave is to the health and economic security of people with disabilities. The paper poses several recommendations for improving paid leave laws to make them more accessible to people with disabilities, such as more progressive wage replacement, job protection, and continuation of health insurance during leave. These improvements actually make paid leave more effective for everyone, especially the most vulnerable low-wage workers. And I'm sure Sarah Jane will explain, many of these provisions have already been included in the latest laws, such as the one about to go into effect in my home state of New York. So without further ado, I'm glad to introduce Sarah Jane Glynn, a nationally recognized expert on paid leave and now a senior fellow at the National Academy of Social Insurance.
Thanks so much, Anna, and thanks to everyone for taking the time to join the call. I'm really excited to have the opportunity to talk with you all about some of my latest research that I've done with the folks here at NASI that hopefully will be useful to all of you. And my presentation today is going to largely be an overview of information that's provided in much more detail in the brief that we have coming out. And I've been told that everyone who's on the call will be receiving a link both to the slides from the presentations today, but also to that report. So hopefully that information will be useful to all of you in the work that you're doing in your states and communities as well. So I want to start off just kind of at the super high level, talking about this idea that Anna brought up really well, that everybody benefits from these types of leave policies. And so, when I'm going to use shorthand of just talking about paid leave a lot of the time, but I want to make it clear from the beginning that what we're talking about here is paid family and medical leave. So this is paid time off to address self-care as well as care for other family members. So this includes temporary disability leave for workers who need time off to address their own health conditions, parental leave for birth or adoptive parents who have a new child in the home that they're caring for, and then family caregiving leave, which can be a much broader category, including, elder care, caring for other family members who have medical needs, whether they're young or old. And it's helpful to keep in mind that right now, while there's incredible movement at the state level, and I'm going to talk a little bit more about what those programs look like, at the federal level, there are no paid leave policies at all. Workers in the United States nationally do not have any guaranteed access to any time off from work with pay. And we're the only advanced economy to be in that state. So, in one way of looking at this is that we have a lot of work ahead of us because, we don't have a national policy in place, but I think that it's really useful to look around the world and see that every other advanced economy has managed to figure this out, so there's no real reason why the U.S. can't do so as well. There are some folks, and probably many of you on the phone are in this group, who are lucky enough to have employer-provided paid leave. So we know currently, if we look at the civilian workforce in the U.S., about 14% of workers have access to paid family leave that's voluntarily provided by their employers, and about 38% have access to temporary disability leave that they can take for their own health conditions. So these are pretty small groups. And one thing that's important to keep in mind, too, when we're talking about this top-level data like this, is that while we can say that 14% of workers have access to paid family leave, we don't really know what that looks like, right? So this includes everybody from the folks at Netflix who have up to a year, theoretically, of paid parental leave, to folks who may only have a week or two available to them. And, this is a piece that I've been thinking a lot about sort of at the personal level lately because my best friend just adopted a new baby, right, just a couple of weeks ago. She has a 3-week-old infant at home. And she lives in a state that does not have a paid leave program. And she works for an employer that's not covered by the FMLA because she works for a small business. So she is not legally eligible for any form of paid leave at all. And, even though her employer does offer temporary disability insurance voluntarily, she's not a birth mom. So she wasn't pregnant, she didn't give birth, therefore she's not eligible for any leave under temporary disability the way that other women who give birth may be able to use that leave if it's provided by their employers. So there's a lot of folks who fall through the cracks. And those are the people that I think are useful for us to keep in mind as we're going through this webinar today, but also in all of our work, because I think oftentimes the conversation around paid leave and the conversation around these types of policies, at least in the media, oftentimes focuses on wealthy women taking maternity leave. I think that's where a lot of the focus ends up being, or just women who are taking maternity and pregnancy-related leave overall. That's where most of the research, even the academic research, has been concentrated. So I would encourage all of you, I mean, obviously that's a really important group of people that we should be supporting and thinking about, but I think all of the presenters today are going to encourage you to be thinking more broadly and taking a more inclusive view of who the folks are who need access to paid leave. So I'm going to run through this very quickly. I know it's a lot of data. You will have access to these slides, and there's far more information that will be available in the brief as well. But there are a handful of states that currently have programs in place. At the national level, we do have one work-family law, the Family and Medical Leave Act, that can provide job protection to some workers if they qualify, but it does not guarantee any wage replacement. So about 60% of workers will receive job protection if they need to take time off for themselves or to care for a family member or a new baby. But that does not mean that they will receive any money while they're out on that leave. So understandably, it should not come as any big surprise then to learn that among people who needed leave but did not take it, the most common reason why was because they said they just couldn't afford to take unpaid leave. And I'm sure even many folks here would admit it would be hard for them to take extended leave if they needed it, medical time off to care for themselves or someone else, and having their income drop down to zero. So job protection is important. I certainly don't want to knock the FMLA. This was a landmark law when it was passed in 1993. I think it's a really important piece of legislation, but it's definitely not fully sufficient to meet all of the needs of the workforce today. And then, you know, we do see some programs in place in states. California, New Jersey, Rhode Island all have temporary disability and paid family leave programs that are currently in place. In those three states, these programs are organized as social insurance programs that are run by the state. They're funded through payroll taxes, and when workers need access to leave benefits, they apply to the state and receive wage replacement through the state. In California and New Jersey, there are some limited options for employers to offer private benefits rather than going through the state system, and I'm happy to talk in more detail about that later if it's something that's useful to people. But what's important to keep in mind is that these three programs are primarily social insurance, and that's where the bulk of the interactions with leave takers happens through these state programs. New York, as Anna mentioned, currently has a temporary disability program that's up and running. They've passed legislation and will start offering paid family leave next year. New York's system runs a little bit differently. So there is a state fund that is offered through the state as an insurance fund that's offered by the state. But the majority of employers don't go through that state product, right? The majority of employers in New York have private options where they're working with private insurance companies to purchase temporary disability and starting next year paid family leave policies to cover their workforce. And this is a much more complicated way of administering the program, but it makes sense in New York because they have such high regulation of the insurance industry in that state, a feature which is not replicated in most other states in the U.S. And then finally, Hawaii is sort of the outlier here. They do have a temporary disability insurance law, but it's enacted as an employer mandate. So virtually every employer in the state is required to provide temporary disability insurance to their workforce, but there is no state option for them to purchase it. They either have to self-insure or they have to purchase a policy through an approved private vendor. But this operates very, very differently. And unfortunately, because the system in Hawaii is entirely privatized, as a result, we don't really have a lot of data on how it's working or conversely not working because it exists entirely as a private interaction between employers, their workforce, and these private insurance companies. And so, like I just mentioned, you know, New York is going to be expanding their TDI policy to also cover paid family leave starting in 2018. The District of Columbia and Washington State have also both passed legislation to create paid family and medical leave programs. Those are currently slated to become operational in 2020 in both states. And those are also structured as social insurance programs. The bill that was passed in D.C. would create a district-run social insurance system with no options for employers to provide private benefits through the legislation that was passed last year. And the program that was recently passed in Washington State does allow some limited options for employers who already provide generous benefits to their workforce. But again, it's primarily a social insurance program that is run and operated at the state level within state government. And as you can see going through these tables, again, all of this will be made available to you. You know, there is variation in terms of the length of leave available, how workers are determined to be eligible, wage replacement, how they're funded, et cetera. And we'll go into that a little bit more in detail later on. So, you know, in thinking about what folks in states that don't already have these programs should have in mind as they're trying to make some decisions, you know, from my perspective, deciding how the program is going to be structured and what the administrative structure is going to look like is one of the key threshold questions that needs to be addressed long before you get into issues around politics or the generosity of the program. I think it's really important to come at it from the very beginning thinking about how would we actually make this happen in a nuts and bolts, nitty-gritty kind of way. I know that isn't like the funnest, sexiest way to think about paid leave, but I think that it can address a lot of problems that can potentially crop up later on if all policy decisions are made coming back to this central idea of how are we actually going to make this work and what's going to be the most efficient and cost-effective way to structure a program. So based on the research that I have done and all of the work that's been done with other folks here at NASI, you know, I think that the conclusion we have come to is that when you're talking about paid family and medical leave, social insurance is the most efficient and cost-effective way to structure a program. And I personally believe that to be true whether you're talking at the state level or at the national level. You know, no matter what, we're talking about creating something new. And I think that can make folks nervous. But, you know, it's important to remember that government is supposed to provide benefits to folks, right? This is one of the functions of government. And that as times change, as the population changes, as folks' needs change, government creates new programs. This is something that has historically been done nationally and at the state level. So it's not as if states don't have experience doing things like this before. It's not as if the federal government doesn't have experience doing things like this before. States already run social insurance programs, such as unemployment insurance, right now. And creating a social insurance program allows you to minimize costs while maximizing the pooling of risk and resources. So that's part of the reason why I believe it to be by far the most cost-effective way. And there's nothing in the creation of a social insurance program that prevents employers from offering more generous benefits if they choose to do so. And the state systems that exist currently do have ways for high-road employers who choose to offer longer lengths of leave or higher levels of wage replacement to top off those benefits that their workers are receiving from the state. So even if you have a state-run system, there's nothing that precludes employers from going above and beyond it if they choose to do so. You know, as I had mentioned already, California and New Jersey do offer some options for employers to provide benefits in place of the state social insurance program. Part of that was done simply because of the historical legacy of benefit provision within those states. You know, I think it's important to keep in mind that New York, Rhode Island, New Jersey, and California all created their temporary disability insurance programs first back in the 1940s, and then have added paid family leave to that in more recent years. So in a lot of instances, these states were operating within confines that had been set decades before, right? So when they were adding family leave, they were already kind of operating within a particular system that had been codified into law and that employers were already familiar with. States that are looking at creating something new One way of looking at that is that, oh my gosh, this is so scary. We don't already have a TDI infrastructure. How are we going to do this? Another way to look at it is to take the approach of the world is our oyster, and we can create whatever we want because we're not limited by laws that were passed in the 1940s. I think that there's a belief in some sectors that there are benefits to providing employer opt-outs. Certainly some high-road employers who are already providing very generous benefits may appreciate this option because it allows them to continue doing what they're doing and not have to change anything in order to interact with a state program. But I would argue that these folks are likely to be an extreme numeric minority in any state. And adding this option for employers to remove themselves from the state social insurance system and provide their own benefits, whether purchased from a private insurer or self-insured, adds a tremendous amount of administrative complexity. And it also creates some real problems around the potential need for employees to disclose medical information to their employers in the case of TDI. And I think that there are some real concerns about how this can increase program costs if a lot of employers choose to opt out. In California, for example, there's a team of about a dozen people who are charged with overseeing employers who have opted out of their state system, and there's only about 2,500 employers who are in that pool. So they've got a dozen people overseeing a relatively small portion of the total employment landscape within the state of California. So it's not a cheap thing to do. And I think there are also concerns that when employers are offering private benefits in addition or in place of a state-provided benefit, this can lead to job lock, where employees are reticent to leave a job, even if it's for a much better one, if they feel they're going to lose a benefit or they might get shut out of the state system if they're changing employment. Like I also mentioned, the other option that we found when we were surveying the field was that you've got this state system that exists in New York where there is a state insurance fund, but it exists within a landscape of highly regulated private options. So the state is not the most common insurer within the state, and private industry has taken over the majority of TDI policies in the state of New York. And this works in New York for a number of reasons that are based on sort of the legacy of how benefit provision developed over the decades within the state. But no one else has that strong existing regulatory framework at the state level to oversee private insurance carriers and to audit compliance and set community ratings in the same way that New York does. So while this is a system that made sense there, I would really strongly caution states who are thinking about replicating that model to take a look at their own regulatory agencies and their own regulatory experience, because this is an approach that requires very, very strong oversight and is very administratively complex and would oftentimes require adding on additional abilities within state government that it does not currently possess. So while states do have experience doing things like running social insurance programs, most do not have experience highly, tightly regulating the private insurance market. And then, finally, there's the Hawaii option, which is offering employer mandates, and this is something that has come up in some contexts at the state level. And I think part of the appeal to folks here has been that it can reduce the role of government. But my argument here is that while it does reduce the role of government somewhat, it does not eliminate the role of government entirely, and it can add on additional roles and complexities that state governments are not necessarily well equipped with already, and has real significant negative impacts, or the potential for very significant negative impacts on workers. Anytime you have an employer mandate, it is more difficult to regulate because you're removing the state from those relationships. I think folks who live in states that have passed paid sick days law, this is something that they have experienced and are currently trying to address in a lot of contexts. How do you make sure that employers are actually following a new law? How do you make sure that they're aware of all of the requirements? I think there's always the case of bad actors who intentionally defy regulations, but I think there's also problems about folks who are pretty well-meaning but simply don't understand or know all of the complexities that can go into programs like this. That's something that we've seen with paid sick days, and something like paid family and medical leave that is far more complex and involves people taking leaves for much longer periods of time. I think there's a great potential there for employers to have difficulty navigating a mandate. There's also concerns that this could lead to pretty significant employment discrimination, where women of childbearing age or workers who were viewed as being likely to take leave would potentially be discriminated against. And it's much more expensive for employers and employees because this is a setup where you're introducing profit motives, right? So the difference between an employer mandate and something like the high regulation that exists in New York is that in New York they're able to actually set community rating, right? So what that means is that every employer is paying the same rate to cover their workers for TDI, and employees will be paying the same rate for paid family leave once that goes into effect. When you have something that's a pure employer mandate that allows for-profit industries to step in and start offering a benefit, you're introducing profit motives, you're introducing the potential for experience rating, and it just becomes much more expensive and much more difficult to manage. So, I think, like I said, to me, that's sort of the first threshold question, is thinking about what type of organizational structure a state is going to take when if they're moving forward and trying to explore how to offer paid leave to workers there. But there are a number of other decision-making points. One of the ones I think that gets talked about quite often is what conditions should be covered. And I think that there is healthy debate in a lot of circles around whether folks should be just thinking about parental leave, whether they should just be thinking about family care, or whether they should only be talking about temporary disability, or do you do all three at once? Oftentimes this conversation comes down to the costs associated with temporary disability insurance. We know that TDI is the most common form of leave taken, and as a result is the most quote-unquote expensive aspect of a paid leave program because it's the one that's most frequently used. But when folks have brought that argument to me, my response has always been the fact that it's the most common form of leave. Yes, that makes it the most expensive to cover, and I have expensive in quotes here because it's not actually that expensive once you spread the cost across the entire workforce. But this also indicates it's the most needed type of leave, right? And every worker has the potential to need temporary disability leave. So these are things to weigh in mind. A very narrow program that only offers parental leave to new parents is going to be less expensive simply in terms of benefit provision, not necessarily in terms of administration, but in terms of the amount of money that would get paid out to leave takers. You're looking at a lower sum because fewer people have babies every year. But that also limits the pool of people who are going to feel personally invested in it, right? If you're older and have already had your children, if you're not someone who plans on starting a family in that way, then you may not see yourself reflected in it, whereas every worker potentially has the need for disability leave because every worker has the potential to become disabled at some point during their life. So these are just some of the questions that I would encourage people to be thinking broadly about as you're going through and trying to decide the scope of a program. It's certainly important to keep costs in mind, and you would want any program to be as cost-effective as possible, but also making sure that you're reflecting the needs of the workforce in your state. The length of leave is another question I think that is continuing to evolve. Workers have up to 12 weeks of job protection under the FMLA if they're covered. The existing state programs allow leave to be stacked. So this is another thing that I think is important for people who are in states that are exploring creating an entirely new program to take into account. In California, for example, you're eligible for up to 6 weeks of family caregiving leave. You're also eligible for up to 52 weeks of TDI. So what this means is that if you're a birth mother, you can take disability leave that's related to your pregnancy and recovering from childbirth, and then you can stack your family leave on top of it. So in practice, that means that most folks in the state most birth mothers in the state are receiving more than 6 weeks of parental leave. But if gender equity is a concern, then I think it's something that's worth thinking through. And this is something that Washington State has explicitly taken into account as well. Setting caps at different levels to make sure that you don't have some groups of workers that are eligible for significantly more leave than others. And then I've totally gone over time, so I'm going to run through this super, super quickly. But basically, wage replacement is another incredibly important issue to keep in mind. Obviously, the level that wage replacement is set at is going to determine largely what the overhead for the program is, because the biggest expense is going to be benefit payments, obviously. But it's really important to make sure that low-wage workers aren't being left out of any program. California has a pretty low level of wage replacement at 55%. They're increasing that next year. And part of that was because they went out and did research and found that low-wage workers weren't using the program because they just couldn't afford to. So one thing that we're starting to see being explored more and more is these tiered systems where low-wage workers receive a higher level of wage replacement. And I think that that's one avenue that's really worthy of further exploration to make sure that the folks who are most vulnerable are not being excluded from these programs. And then, y'all can go through this. Funding is another big piece that is worth exploring, but there's different combinations of payroll taxes that have been used to fund social insurance programs. And it largely depends on, I think, the needs of your particular state and the political context as well. So just in conclusion, I think that what's really important and what should be guiding all of these decisions is how do you create a program that's going to be efficient and cost effective? That's obviously really important. But how are you also going to make sure that the program reflects the needs of all workers and that you're providing universal access so that the most vulnerable folks, whether they're low wage, whether it's people with disabilities, whether it's people who are LGBTQI, the people who are marginalized in other ways in our society, unfortunately, you want to make sure that they're not also being marginalized through the creation of a paid leave program within the state. So with that, I've gone way over time. I'm going to turn it over to my colleague, Kate. And thank you all, and I'm happy to answer any questions that folks may have.
Thank you so much, SJ. I'm now really eager to hear from Kate, from Katherine Gallagher Robbins, the Director of Family Policy for the Poverty to Prosperity Program at the Center for American Progress, who will be talking about the chosen family definition and giving us a sneak preview of some new research done at CAP. Kate, take it away.
Thanks so much, Anna, for the introduction, and thanks, NASI, for hosting this terrific webinar. I'm really excited to be part of this great panel. Let me say I'm presenting work done in partnership with CAP's LGBTQ team, as well as the work we collaborated with Family Values at Work, Forward Together, A Better Balance, the Family Justice Network on, all of whom have just been tremendous leaders in the work on inclusive paid leave, and I'm really grateful for their partnership. So Americans have all different kinds of family structures. Currently, fewer than 20% of households adhere to the quote-unquote nuclear family model of a married couple and their minor children. An increasing number of Americans live in multi-generational households, and according to new polling data from Family Story and Lake Research Partners, a majority of unmarried mothers would contemplate raising their children with an adult who is not a romantic partner. The American family doesn't, and frankly never has, fit the 2 kids, 2 parents, golden retriever image that some people like to think of. And this is why it's so important for us to define family in ways that meets the needs of all families. And to this end, there's been increased attention on chosen families. Chosen families form when 2 or more otherwise unrelated people develop a deep, significant personal bond, like a bond that exists between family members who are related by blood or legal ties such as marriage or adoption. So these are people who have great importance in your life, who fill familial roles that otherwise might be filled by people who are related by law or biology. And there are lots of different kinds of chosen families, so I wanted to share the story of one person. This is Yi Wan, who was featured in our December report we did with the Family Values at Work, A Better Balance, and Forward Together coalition I mentioned earlier. And as you can see from the story, Yuan relied on chosen family during transition surgery and through cancer. So the chosen family were there to celebrate highs and to offer support when necessary. And that's just one story among many. So CAP has, as Anna mentioned, a forthcoming report on the extent to which people rely on chosen family to support them when they're in ill health, if they're sick, if they're injured. And the report is based on a new survey that CAP did, which we believe, as far as our research has shown, to be the first nationally representative survey on the issue of chosen family. So I have to be a little cagey. I can't quite share all the details of our data yet because they're not public, but I wanted to talk in broad strokes about our findings. So the data show that the need for paid leave that includes chosen family is broadly shared across many, many different types of people, some of whom I've listed here on this slide. The data also show that there is a need, especially acute need, for paid family leave that includes, and paid sick leave that includes an inclusive family definition for people with disabilities and LGBTQ people. And those are groups that are more likely than other groups of people to report taking time off of work to care for a chosen family member. And that's part of why I'm so excited about the new report that Callie is going to be talking about that Georgetown did in coordination with the ARC to highlight the importance of paid leave for people with disabilities. So it's critical that our public policy recognizes and supports the range of American families that there are, including chosen families. And unfortunately, our history is filled with examples of times when family has been defined in ways that marginalizes or stigmatizes certain types of families, often denying them benefits and services that they need and deserve. For example, state mothers' pension programs, which later gave way to National Aid to Dependent Children program and finally became TANF, often excluded unmarried mothers. And DOMA is, of course, an example, another key example of a time when families were excluded. So obviously same-sex partners were denied numerous rights and benefits from civil marriage at the federal level until DOMA was ruled unconstitutional in 2013. And even though marriage equality is now the law of the land, many LGBTQ families continue to be excluded by narrow family definitions at local, state, and federal policies. And paid leave policies, if they have narrow family definitions, can exclude certain types of families, which is why defining families inclusively is so important. For example, in the story I spoke about earlier, without an inclusive definition in place, even if paid leave were available, which we know from SJ's presentation it often isn't, if there wasn't an inclusive chosen family definition from that paid leave, there would not have been adequate support. So fortunately, there are several ways in which different levels of government have inclusively defined family. For example, federal regulations issued in 1969 during the Vietnam War allowed federal employees to take funeral leave for the combat-related death of immediate relatives. And the way they defined immediate relatives in this regulation was anyone related by blood or affinity, and by that they mean a close association with the employee that's the equivalent of a family relationship. And for federal workers, this definition was later expanded into different programs, including paid sick time. And it's really the origin of chosen family being recognized in the U.S. And states and localities have defined family in a number of different ways that's inclusive. I've lifted up a few here: New York, which we were talking about earlier, Chicago and Cook County, and we have many other examples of model language around paid leave policies in the December report that we published. As we mentioned in December, when our report was issued, actions in the last half of 2016 alone gave nearly 7 million Americans access to paid sick time with an inclusive family definition, and we've already seen more action take place this year, including Rhode Island, which recently passed a paid sick leave with paid sick days with inclusive family definition. So there's much forward progress to be excited about, and there's a lot of different pathways to get there.
Thank you so much,
Thanks
Kate.
so much. Really appreciate it.
Finally, I'm really excited to introduce Kelly Grant, the Senior Policy Associate for the Economic Security and Opportunity Initiative at the Georgetown Center on Poverty and Inequality. Kelly will talk about the importance of paid leave to people with disabilities and the policy designs that can best meet their needs.
Thanks, Anna, and thanks everyone for joining today. So yes, I'm going to talk about the importance of paid family and medical leave for people with disabilities and their families. First, I want to give everyone a little bit of background on the report that the Georgetown Center on Poverty and Inequality and the ARC just released. We all know that the need for paid family and medical leave is universal, and so why we were so excited to do this report is that we got a chance to expand the conversation to include the less examined disability angle. And this is because nearly all of us will need paid leave at some point, whether to care for family members or our own serious medical condition, or to welcome a new child to the family. Workers with disabilities need paid leave for the same reasons as everyone else. And PFML can be particularly important for families that are welcoming a new child with a disability, and for family members and for family caregivers of children, adults, and seniors with disabilities. So here's just a little overview of what I'll talk about today. And first is disability and work in the United States. In the U.S., nearly 1 in 5 people have a disability, and over 1 in 4 households includes at least one person with a disability. Physical, mental, and sensory disabilities affect people of all ages, including children, working age adults, and senior citizens, as you can see from this graph. And for the sake of time, I'm going to skip through the next few slides, but I've included them in case anyone is interested in the breakdown by race and gender. So, disability and financial insecurity are intertwined. This is because workers with disabilities and their families on average have lower incomes and savings and have increased out-of-pocket medical and disability-related costs. And here are, again, some slides that I'm going to skip over, but they drill down a little bit more into this aspect of the report. Moving on to the key findings from the report, we found that the prevalence of disabilities across the lifespan and demographic changes indicated a real need for more comprehensive policies that can address the realities of work-family balance needs. So approximately, as you can see in this chart, approximately 2 in 5 adults report caring for an adult or child with significant health issues, although the majority reported having to take leave for their own illness. This caregiving is most often unpaid and can impact one's own employment. For example, a recent survey found that 24% of caregivers of adults aged 18 or older reported that they either had to reduce their working hours, take a less demanding job, give up working entirely, or retire early. Paid family and medical leave can help workers navigate their family's needs and help more family members maintain work hours, stay in the workforce, keep their careers on track, and address their own health needs. And this is a great segue into our second finding, which is that paid leave helps workers care for themselves and their family members. Addressing one's own illness, as I said before, is one of the most common reasons U.S. workers take unpaid leave. And so having paid leave increases opportunities to take time off for a serious medical condition without having to see a sharp drop in your income or put your job or your employer-based health insurance at risk. In addition, having paid leave can increase access to preventive care, such as being able to go to doctor's appointments, and can lead to better overall health and well-being for the worker and their family. Our third finding is that paid leave boosts economic security and opportunity. We know that because households that include individuals with disabilities often have low to moderate incomes, any time taken off by a working adult can result in severe economic consequences. And for many, the impact of job loss would be financially devastating. So when workers have access to job-protected paid leave that replaces a sufficient percentage of wages, they and their families can often avoid some of the pitfalls associated with taking time off work, like lost income and potential depressed wages in the future. Having paid leave may also enable workers to take time off rather than being forced to switch to part-time work or to a lower-paying job. And finally, we found that particularly for people with disabilities and their families, access to paid leave is limited, and this is especially so for individuals who are low-income, women, young, LGBTQ, and/or people of color. This is partially because workers with disabilities are more likely to have the types of jobs that are the least likely to offer access to any type of leave. These are types of jobs that are low wage, part-time, and/or lack flexible schedules. And unfortunately, these gaps persist even in states that have established their own PFML programs, because current FMLA and state regulations exclude many workers who are part-time or in low-wage jobs. Finally, onto some policy recommendations. While this paper wasn't a proposal, we did want to outline some of the key principles from our findings that could inform how PFML policy can more fully support people with disabilities and their families. And there's a more extensive list in the paper itself, but the top line ones are that inclusive paid leave policy should be accessible to all working people and reflect a modern definition of family. 2, cover all of the major reasons people need to take leave, so for one's own health, a family member's health, a new child, etc. 3, have a sufficient wage replacement so that people can make ends meet, and as well as a sufficient leave duration so that it's long enough to promote positive outcomes. 4, ensure people can keep their jobs and health insurance. And 5, include education and outreach that is fully accessible to people with disabilities. And also, because of the great work and the existing programs already at the states, we also have some great examples of things to keep in mind if you are thinking about designing your own paid leave policy. And these include that having, of course, job protections is important, as well as having sufficient percentages of wages, because we know that both of these are especially consequential for workers with disabilities and their families who may be particularly at risk of experiencing discrimination at work and may be fearful of retaliation or other significant deterrents for taking leave otherwise. And in conclusion, we found that paid leave is extremely consequential to a family's ability to have economic stability and security, and especially so if that household has a person with a disability. And thank you so much. I'd be happy to answer any questions after this. And I'll turn it back over to Anna.
Great, thanks, Callie, and many thanks to all of our presenters. So as Sarah Jane said, you will get an email with all of the slides as well as a recording of the webinar, and they will also be available on NACI's website, naci.org. So in a few minutes, we're going to open the discussion up for questions, and you can start thinking about your questions and type them into the chat box on your screen. While you're thinking about questions and writing them in, I'd like to turn to some people on the call who have had direct experience turning these policy recommendations into reality. So a couple of the participants mentioned A Better Balance, and we have on the line Jared Make from A Better Balance, who helped create the Family Justice Network, which is a collaboration between A Better Balance and Family Values at Work, which has been working to expand the definition of family and paid leave laws. So Jared, can you share what's been achieved and what you're learning, and maybe say a few words about the most recent law that's passed in Rhode Island?
Yeah, thanks so much, Anna. So for those of you who aren't familiar with A Better Balance, we are a national legal nonprofit working around the country on work-family issues. And as part of that, we drafted a model paid family and medical leave bill, as well as a model paid sick time bill with the National Partnership for Women and Families. and have been drafting a lot of laws around the country, including the paid family leave law that's been mentioned in New York, which is where we are based. But as Anna mentioned, A Better Balance and Family Values at Work formed a joint LGBTQ work-family project, and as part of that created what we call the Family Justice Network, which is a cross-movement space for LGBTQ, economic and racial justice, reproductive justice, labor, and aging groups. And I should mention Kate and the Center for American Progress are part of this. And by working together, one shared focus that emerged from the network is around family definitions. And we are working with both national and state partners to highlight the fact that our family definitions in law and policy often don't reflect the reality of our caregiving and what our families look like, as Kate mentioned. So I do just want to say that the research that can be done on this, like the Center for American Progress's forthcoming data, is really critical to raising attention in education. But just to mention quickly, in just over a year, there's been numerous paid sick time laws that passed with a family definition that not only includes specific family relationships, but also chosen family, as Kate described. And that includes Los Angeles, Chicago, Cook County, Illinois, St. Paul, Minnesota, the state of Arizona, and most recently, as Anna mentioned, the state of Rhode Island. And I should acknowledge Rhode Island State Senator Gail Golden, I believe, is on the webinar today as well, and the importance of having legislators who are also helping to raise awareness about this. So those laws I just mentioned cover all chosen family, and in Rhode Island, it was through a definition around care recipients, making sure that people can use their paid sick time to care for those who they are responsible for providing care for. So we're just excited about more policies acknowledging what families actually look like. And I think the last point that I'll mention is that this work really started with a focus on LGBTQ individuals and families, but it's grown and it's really brought new partners into paid leave work and raised education about what our families look like. So the fact that veterans, people with disabilities, low-income workers, immigrants, of course these aren't mutually exclusive populations, but the fact that so many of us have families that often aren't reflected in our laws and policies. So we're excited to keep working and raising education about this, and now thinking about how to have stronger paid family and medical leave law family definitions that cover both chosen family, but also the other relationships that are often critical, like siblings, parents-in-law, unmarried partners, and making sure that these laws really do reflect what our relationships look like.
That's great. Thank you so much, Jared. Also on the line is TJ Sutcliffe from the ARC, which is a network of organizations around the country promoting and protecting the rights of people with intellectual and developmental disabilities. TJ, could you say a few words about how the disability rights community is beginning to engage with the paid leave community to really bring the recommendations that Callie discussed to fruition?
Yeah, absolutely. And I just really appreciate the National Academy of Social Insurance offering today's webinar and everyone who's participating and presenting today. One of the things that we're really encouraging disability activists to do across the country is to get educated and to engage on this issue. It is so important to be part of the conversation, and webinars like today's session are a critical part of that. One thing that we think is really powerful for people to do is to share how paid family and medical leave impacts their lives personally. In conjunction with the paper that we were really thrilled to release with the Georgetown Center on Poverty and Inequality, at the ARC we've also released a video highlighting one family story in New Jersey that had both a positive as well as a negative experience with a time when they needed to take family and medical leave, but they were not able to access pay, and it really impacted that family economically. And also we're highlighting a number of other families and individuals with disabilities who have been generous to share their stories and their perspectives on paid family and medical leave. So we're highlighting those stories on our website, which is thearc.org/paid leave. And we also have options there if people want to share their paid leave stories with us. People are welcome to do so, but we also just think it's really important for people with disabilities and family members of people with disabilities to engage with policymakers. Earlier we heard about how important it is to really think through at a granular level how policies may work, particularly as they're in development and even in that pre-legislative stage. So now is the time to get involved in so many states across the nation and also at the national level as policymakers are really beginning to think through these issues. Two other resources that I'll just flag really briefly because there are so many great ways to learn more about this issue and become part of the conversation. But one group that was mentioned earlier is Family Values at Work. And on their website, you can actually access, they have a map where you can click on to see who's having conversations about paid family and medical leave in your state or local area. So they're happy to connect people as a resource. And then also there's a website that's paidleave.org, operated by the National Partnership for Women and Families. And again, they just have a range of educational materials that people can access. So again, thank you guys so much, and just really excited to see this conversation move forward.
Great. Thank you, TJ. And speaking of family values at work, our first question is from Ellen Bravo, who is the co-director of Family Values at Work. And it's a question directed to Sarah Jane, and she asked if you could share your views on employee opt-out provisions in paid leave policy.
Sure. So, I touched briefly on the fact that some existing state programs offer opt-outs for employers, but some states have also looked at this idea of letting workers themselves choose to opt out of the system. And I think that this is problematic for a number of reasons. So one is that if I, as a worker, am trying to decide whether or not I want to be enrolled in this social insurance program for paid family and medical leave, if I know that I'm planning to have a baby in the next 2 years, I'm much more likely to voluntarily enroll in that program than if I'm not planning on starting a family, for example. So you have people who are selecting whether they want to be in or out of the program based on needs that they know they're likely to have. The same thing, if I know I'm going to need time, I'm likely to need time to take care of my mom, so I'm more likely to opt into the program if I have the option. And what that means is that the program suddenly becomes much more expensive because if conversely someone who doesn't have any children, is not planning on having any children, has no family that they would be caring for, they might be more likely to say, nope, I want to opt out of the system. And so you're creating a much more expensive insurance program if you have folks who are selecting in and out based on things that they know about their own risk for needing the leave. The other problem, even just beyond that, because some folks might say, well, what's the big deal, right? If you know you're going to use it, then you're paying more, whatever, you're getting the benefit. But the problem is also that some of these risks you can't anticipate, right? Any one of us, knock on wood, right, could get hit by a car on our way home today. Any one of us could go to the doctor and be diagnosed with a serious illness next week, right? There are some of these things that you simply cannot anticipate. And so when workers are able to opt out of TDI funds in particular, that means that they are exposing themselves to huge amounts of risk. And we know, based on lots and lots of research, that people are not really very good at determining what types of life events, risky life events they are and are not likely to experience. So people significantly underestimate how likely they are to need disability leave, for example, or to need medical care in the future, their likelihood of becoming disabled or having a serious health concern at some point. So I would strongly encourage states not to go down that road. Because it's likely to just result in a system that has much higher costs and unfortunately is going to leave out a lot of people who are likely to need protections at some point in their work lives.
Okay, great. So we have two questions that are somewhat related about small business owners. The first is asking what are the best practices to address the needs of small businesses. And the person asking the question says, I'm assuming that social insurance is best, but are there other aspects that we should be keeping in mind? For those programs that are considering exempting or modifying the program for small businesses, what best practice do you recommend? And then another participant asks a specific question which our panelists may or may not be able to answer because it may be too state specific. But the participant says, I'm a small medical practice owner and I'm trying to figure out how we can accommodate our employees for paid maternity/family leave of 6 weeks. Then she can add on her own accrued time. We are Massachusetts based. After listening to this, am I correct we should be looking at TDI? I'm concerned about TDI because it doesn't cover pre-existing. For example, the pregnancy is confirmed before the TDI is in place. So I'm guessing, SJ, these probably are both for you, but if anybody else can add, please go ahead.
Thank you. And I think my recommendation would be for the person in Massachusetts, my contact information should be included somewhere in the materials that are going to be circulated. So if you want to reach out to me directly, I'm happy to talk through this with you because I think that I may need to ask a lot of clarifying questions, but more than happy to discuss with you to figure this question out. And the small business piece is really interesting, and this question made me think back to a roundtable that I was part of last year in Philadelphia, where we met with a handful of small business owners and kind of talked to them about the uniqueness of how a small firm operates compared to a really large company. And there are things that are different when you're talking about small businesses versus really large ones. I actually come from a family of small business owners, and I have seen firsthand that it really does look different, right? When you're talking about a business that maybe only has 5 people working in it, when one person goes out on leave, the impacts are felt a little differently than when you're talking about a company with 200 people. But one of the things that was really interesting to me when I was talking with these business owners in Philadelphia was that they kept stressing how much they wanted a social insurance program because one of the things that was really difficult for them to figure out was the uncertainty, right? And so what they were telling us was that people go out on leave. It happens. Things happen. People have children. People need to care for their family members. People get sick. People need to have surgeries. So small businesses are already dealing with this. They're already dealing with employee absences, and different companies have different unique ways of making it work for them. And I think there are some best practices that are out there, and I know Small Business Majority has a lot of information on this as well. But one of the things that they just kept saying over and over again was that they wanted to offer paid leave, but it was really hard for them because they didn't know when they were going to need to do it. Sometimes you can plan ahead, right? If someone's giving birth, you, generally speaking, have some notice before that takes place. But medical leaves and other forms of family caregiving can be emergency situations that you're not anticipating. And something like a social insurance program where you're paying a very, very small amount in every month allows you to plan and to fund a program like this in a way that's not all of a sudden I call you up this morning and tell you you've got to deal with the fact that this worker is going to be out, and also here's a mandate, now you have to pay their salary while they're gone, but you've already been making these very small payroll contributions every month for the last year, so when that worker needs to access wage replacement, there's already a state system in place to help them. So, in all the conversations I've had with business owners, small business owners in particular have really come out, at least in talking to me, in favor of social insurance far more so than something like an employer mandate, because it makes it a lot easier for them to manage and much easier for them to fund because it reduces the uncertainty to the extent that is possible, obviously. But I would strongly encourage, I don't have all these materials in front of me right now, but I would strongly encourage folks who are interested in this to check out Small Business Majority's information. They've done a fair amount of research, and I believe have some best practices out there too that I think could be really instrumental for folks.
That's great, thanks. And a couple of follow-ups on that, on these last few questions. small business majorities polling shows that something like 70% of small business owners actually favor a paid family leave policy because some of the larger corporations can afford to pay for this, whereas small businesses can't, and so a social insurance program is actually really an insurance program for the small businesses. So there's been a lot of support from small businesses for this kind of model. And we should also note for the questioner from Massachusetts that there is a campaign ongoing right now for paid family and medical leave in Massachusetts. So perhaps when you reach out to Sarah Jane, she can tell you more about that as well. So I have one follow-up question from Gail Golden of Rhode Island, who Jared already mentioned is on the line, which is Sarah Jane again, whether you think the opt-out, the employee opt-out provisions could possibly lead to gender discrimination.
I think anything less than a universal program, gender-neutral program, has potential for gender discrimination. If we craft programs in ways that at least provide the impression of making women more expensive to employ, that is potentially going to lead to employment discrimination. And so I think that that's why it's really interesting to note this, the FMLA is gender neutral, and that was something that folks really fought hard for. And some folks who I know are part of this group fought really hard for, to make sure that it was not just a policy for mothers, and not just a policy for women who were caregivers within their families, but that it included men as well. And that has really led to a significant change. We have seen over the last generation or so dramatic shifts in the ways that men spend their time, particularly when it comes to family care. And recent polling around millennials has shown that young fathers in particular are really desiring greater work-family balance, that they really want to have access to parental leave to spend more time with their kids. And to be more involved in other forms of family caregiving as well. So there's a tremendous amount of pent-up demand for this. But I think that, if policies are created in ways that are putting too much of an emphasis on women, or are crafted in ways that make it seem as if women are going to be the ones taking the majorities of leave, or creating conditions under which it's easier for women to take leave than men, that is almost certainly going to result in gender discrimination, whether it's intentional or not. And I think it's worth noting as well that, the fact that women are currently much more likely to leave work to provide unpaid family care is one of the leading causes of the gender wage gap. So this goes beyond just thinking in the immediate term about employment discrimination, but I know this is something that Callie had brought up in her presentation. Time out of the workforce also depresses future wages as well. Mm-hmm. So making sure that we are creating very inclusive, universal programs, not just around gender, but around a variety of other identities, is really important to help promote greater, higher wages for folks who are currently suffering from artificially depressed incomes as a result of the lack of these policies.
So I wonder if we can bring Callie into this discussion as well, whether these kinds of opt-out provisions could potentially lead to discrimination against people with disabilities who may be perceived to be more likely to opt in, and also just connect some of the dots between Kate's presentation and Callie's presentation. Callie, perhaps you can say a little bit about the evidence and data there around people with disabilities and chosen families.
Sure. So yes, to add to what was just being said, so workers with disabilities may have significant privacy concerns, or may face fear retaliation if they take leave, and I think that recent studies of workers in California and New Jersey that were already referenced during this webinar have also found that these types of barriers for workers in general, but particularly for workers with disabilities or workers who have family members with disabilities can make a huge difference in whether they actually do take paid leave or not, or any type of leave. And to address your question about why the chosen family definition is particularly important is that, as we've discussed already in this webinar, many find the FMLA protections to be too narrow and not encompassing of the relationships and structures that are important to many different types of families. As Kate mentioned earlier, the vast majority of households don't fit the traditional nuclear family model. And so this becomes especially important within the context of disability and when you're considering natural supports and circles of supports, which can include related family members like siblings, grandparents, and others, and also extended and chosen family members, as well as other people who maybe other people rely on, such as shared living roommates. So expanding the definition to be as inclusive as possible would definitely allow many more people and their support networks to benefit from paid leave.
Okay, great. So we have another question, another state-specific question, this one about Hawaii. And the participant asks, in the Hawaii case, if the state wants to add paid family and medical leave to the existing TDI, can a social insurance program be combined with the employer mandate TDI?
So there's nothing in Hawaii that would prevent the state from creating a social insurance program to provide family leave. And I will, in the interest of full disclosure, say that I have been working with folks in Hawaii to interrogate some of these questions around what that might look like. So I think that integrating the two is complicated because the TDI system is entirely privatized, but that certainly does not mean that the creation of a family leave program would have to follow that same route. I think there are a lot of complicated issues that need to be thought through to make sure that the two could work together. But there's certainly nothing that's preventing the state from going with the social insurance organizational structure for family leave. They wouldn't be locked into having to do an employer mandate there as well. And certainly, for all of the reasons that we talked about today, I think it's worthwhile to explore other options for the state beyond just the continuation of the employer mandate.
Great. I wanted to ask another question that, about another group of workers who are generally excluded from labor law protection, and those are, 1099 workers, gig workers, and this would be a question for our panelists, as well as I know Sherry Lewant from A Better Balance is on the line and has been looking into this. So I'm curious, how are the different existing laws covering or not covering 1099 and other contingent workers, and what should be done moving forward to make the laws more accessible to those workers?
Yeah, hi Anna. This is Sherry at ABB at A Better Balance, and I'm happy to at least take a stab at that question, and other panelists can certainly add. So we've been drafting laws around the country, and I think that it's really important that we keep in mind the changing American economy in crafting all of these policies. It is really easy in a social insurance program, as opposed to, for example, paid sick days, which we also work on, to include those who are not traditional employees. And there are two things that I would just highlight. One is the definition of employee that's being used in paid family leave laws. I think it's really important that we not necessarily rely on what the existing definitions are, because, for example, if you use the minimum wage definitions, in many of the states you're going to end up excluding people who should be included. For example, agricultural workers. There are just a lot of exclusions to minimum wage that people don't really think about. So I think thinking about what your employee definition is extremely important. And then the other way in which we can at least start to talk about or think about including people who are not thought of as traditional employees is to include so-called self-employed individuals in the program. And several states have done that, most recently Washington State. And the question really that arises with respect to self-employed is should it be an opt-in or should it be a mandatory coverage? If it's an opt-in, I think it's important to have some minimum period of coverage so that the employed person can't kind of game the system, as Sarah Jane was talking about, in terms of a more general opt-in system. But I think an opt-in for a self-employed often does make sense, as long as there is some basic period that they have to be covered. So I think that those are two ways in which we can start thinking about including everybody in these systems, and I think it's extremely important as the nature of work has been changing and as we see it changing as we go on.
Great, thanks, Sherry. So we are actually coming to time. Do any of the panelists want to make any final comments on that question or any other questions?
This is Sarah Jane. I just want to reiterate, if folks do have additional lingering questions as this moves forward, please feel free to reach out to me. I'm not hard to find online, and I'm happy to talk with folks if they have additional policy questions.
Great. Well, with that, I would like to thank Sarah Jane, Kate, and Callie, and of course the National Academy of Social Insurance for sponsoring this webinar, and thank you to all of the participants for your active participation and questions. And that will end our webinar for today. Thank you so much. Bye.